and people that I just love, and I'm so happy to see you guys here. For those of you who do not know me, I am Erin Smith. I am one of the junior faculty here in the Movement Disorders Division. So I too specialize in Parkinson's disease and get the pleasure of taking care of many of you. Let's see. Okay, I'm gonna just advance here until my talk pops up. Let's see. This is something I should have done before calling everybody's attention and turning on the lights and everything. Okay. Anybody got any good jokes in the meantime? Or I actually heard a pretty good one from one of my patients' husbands in the back. He said, "What is the difference between confusion and apathy?" And the answer is, "I don't know and I don't care." So I stole that one from in the back. I'll be here all day, folks. Okay, so for my talk this afternoon, this is a pretty loaded one. We are going to be talking about research updates in Parkinson's disease. So this is the question that we all have, right? When are we finally going to find a cure for this thing? Those of you who have talked to me in the clinic know that this is a loaded question for many reasons. Finding that root cause of Parkinson's is one of the things that is the biggest challenge for us in finding this cure. The more that we learn, I think to some extent, the more confused we become about this disease. We're really just at the tip of the iceberg of understanding what is the cause of it and what's happening in our brains in Parkinson's. This iceberg analogy is also what I'm going to use for the scope of this talk. And so what I mean by that is that while I'm going to be trying to cover as much as I can in the 30 minutes that we have allotted here, I'm still only going to be touching the tip of that iceberg. There's still so much more that we could talk about what's happening in research in Parkinson's disease. And so the research that I'm going to discuss today is going to fall under 4 broad-ish categories. So I will primarily focus on what we call disease-modifying treatments or therapies, abbreviated as DMTs. These are the things that are trying to target the pathology of Parkinson's, the cause of Parkinson's. For the most part, I'll be talking about something that Dr. Sire already alluded to in her talk, with the idea that Parkinson's disease is caused by the accumulation of this protein in the brain that's called alpha-synuclein. Other types of research I'd like to touch on today are going to be things that are targeting specific genetic types of Parkinson's, finding ways to detect Parkinson's even before it starts. Those are going to be things that are called biomarkers. And then things that we do to help treat the symptoms better and improve our long-term outcomes. And so I have summarized those in these topics. We're going to talk about developing therapeutics, genetic discoveries, those advancing biomarkers, database studies. I'm going to touch on a couple UNMC studies, and then I'm going to close with telling you how you can get involved in all of this. I'm also going to highlight a couple of things that have landed in the news in the past year. I think a lot of you probably recognize the poster child for Parkinson's disease, Michael J. Fox, pictured on the bottom left. I also am going to touch on those Parkinson's gloves that we all want to hear about, and then some of these other biomarkers that have popped up in the news over the past year as well. As I mentioned, we are only touching the tip of the iceberg today, so there's still so much here that I'm not even going to have time to talk about. And so we're doing a lot for surgical and advanced therapies, so that's going to be things like improving deep brain stimulation, focused ultrasound, or even those infusions that some of you have, what we call the Duopa pump, or even the upcoming pump that goes under the skin, called the subcutaneous pump. We've been working hard on finding better ways to treat specific symptoms that really plague people with Parkinson's. Things like those memory changes, that cognitive decline, freezing of gait, which is a really disabling one, sleep that Dr. Hellman already talked about earlier today. We're just beginning to understand the interplay of nutrition and the gut biome on Parkinson's. We do things that are called quality improvement projects, which is just finding ways to take care of our patients better while they're in the hospital, for example, or how do we prevent falls and those complications from them. Using comparisons of our therapies up head to head and seeing what is better than the other, and even more than that. And so let's dive into these developing therapeutics here. They're going to fall under two main categories. The first being disease-modifying therapies. So those are going to be the cure. Those are the ones that slow or halt the progression of Parkinson's and stop those brain cells from dying off further. The other category is what we're going to call symptomatic therapies. And so those are the ones that help to improve symptoms and restore function. Those are going to be things like your carbidopa, levodopa, the surgeries, those kind of things that we already have and are really intended to better treat the symptoms of Parkinson's. So this is a handy-dandy little paper that's called the Parkinson's Disease Drug Therapies in the Clinical Trial Pipeline. So this was a 2023 update published earlier this year. And if you go to their affiliated website, this is called pdtrialtracker.info, you're going to see the immense volume of Parkinson's research that's happening. And so that's what I want to show you with this slide. And this is actually already outdated. They update this quarterly. So these were the July numbers at the time when I submitted these slides back in September. We had a total of 911 studies that were ongoing in the entire world. And these are clinical trials. As of yesterday, October 31st, this number has already increased to 941. And so that's already 30 studies that have been added just in the past, 3-4 months or so. This is just a map of the country and all the research that's happening in the country. I'll talk a little bit about some of the studies going on here in Nebraska, but you can see how by state, where a lot of the research is concentrated on the coastal areas mostly. This very dizzying photo is intended just to show you all of the different medications and drugs that are being tested. So for no reason should you go through and recall any of these names. But that top right thing called DMT, those are those disease-modifying therapies again. Those are the things intended to try to slow down or cure Parkinson's. On the bottom, that ST means symptomatic therapies. And so look at all these drugs that are currently being looked at to help improve our treatment for choices for this disease. This is just more to marvel at than anything else. I had mentioned earlier that we're also trying to target specific symptoms of Parkinson's. So this is the number of trials that are looking at specific symptoms that you guys all experience. At the top are going to be motor symptoms, of course. So that's things, tremor, stiffness, slowness, walking, all of that kind of stuff. But there's quite a spectrum. So it goes from that. We have cognitive or memory changes. We have depression, like Dr. Woodward talked about earlier. Pain, that anxiety, that apathy, all the way down to constipation and bladder issues. So we have quite the number of symptoms that we can have individual studies targeted at. So let's talk about the mechanisms of these disease-modifying treatments that we're looking at. And so they're going to fall under a couple different categories. Probably the most popular one will be those medications that are targeting that alpha-synuclein protein. So that's that abnormal protein thought to build up in the brain of Parkinson's patients. I'm also going to talk about some diabetes medications, strangely enough, that are called glucagon-like peptide or GLP-1 agonists. Then there are going to be more broad categories of medications, some that you've probably heard of, like antioxidants or anti-inflammatory medications. We've even developed some that are specific to people that have certain gene types of Parkinson's. And Dr. Sire touched on that, and I'll touch on a couple specific ones as well. This graph over here to the right is just to show you that alpha-synuclein protein buildup in that area of the brain where those dopamine-making cells live, called the substantia nigra, that Dr. Sire talked to you about earlier. So just a quick review of that. The hypothesis behind a lot of these disease-modifying therapies is that that protein builds up in the brain, that alpha-synuclein, and everybody actually has this protein in their brains. It's just one that we make while we age. But the thought is that while it's being made, that it gets misfolded, and then it builds up and becomes toxic. And that's what leads to those brain cells dying off in Parkinson's disease. And so the goal of these therapies is to stop that misfolding from happening, and maybe we'll see if we do that, then we could cure this. There's a couple different ways that has been attempted. So one way that it's been done is to try to give antibodies that fight that protein, alpha-synuclein. Some studies have done an IV version of that or given as kind of a vaccine, actually. Other studies have developed things like an actual medication, like a molecule that comes in and interferes with that protein being made. Others come in and then break down the misfolded protein that's already been made. Those studies are all ongoing. So far, seems like people tolerate them pretty well. But the more that we learn about Parkinson's, it may not be for every single patient because maybe not every single patient has a problem with their alpha-synuclein. So it'll help some people, but not every single person with Parkinson's. The diabetes medication that I alluded to earlier, so these are the ones called the GLP-1 agonists. So there's been a study that has suggested that folks with type 2 diabetes actually could have a 30% risk of developing Parkinson's. And so we've been trying to repurpose these diabetes medications with the thought that these receptors that they target are also present in your brain. So they're used generally to help people to produce insulin if they don't make insulin or they're resistant to it. But that's the thought, is that they can pass into the brain and maybe they could help with some kind of inflammation in the brain. Some of these have become pretty popular lately for weight loss. So you've probably heard of like Ozempic and those kind of things. So they're in the same class of medicines. This one, just very briefly, is called exenatide. That is one that's still in a phase 2 trial, not here in the United States. They are studying it in Norway, Sweden, and then South Korea as well. Looking hopeful so far, though, so we'll see what happens. Okay, so I do want to talk a little bit about some of the things that have been featured on TV and the radio and all that stuff, or really hot topics that have come up in clinic with me. So what about those Parkinson's gloves? I think we were all there in December of 2022 when we watched Good Morning America, and they showed this guy pictured on the right, very debilitated by his Parkinson's, having severe tremor, freezing, really unable to function or move at all. He pops on these little gloves, and all of a sudden he's off running a marathon. I think that they probably need to put the little asterisk on the bottom that says results may vary, as with any kind of miracle of sorts. But this is a study being done with through Stanford. A guy named Peter Tass is leading this. And so he had a study back in 2021. He had 6 patients that participated in that. And the people that did try it said that wearing these gloves seemed to help their tremors and their stiffness. The mechanism of them is not super well understood, but the thought is that by applying vibration in the fingertips, it kind of resets some electrical activity in the brain in Parkinson's that's going awry. And we've actually already used this to try to look at ways to improve swallowing and freezing of gait as well. So it's something that's being really closely looked into. They probably won't be approved by the FDA for another couple years, so literally and figuratively, we'll take a while to get our hands on them. So this slide is already out of date. I do want to give an update. So at the time that I made these slides, they were not actually recruiting. They had a survey on their website that you could fill out for future studies, but they actually did just start recruiting again. So you just go to their website and you fill out their form if you're interested in that. I've gotten this question from a couple people. Is there a cough medicine that can help to cure Parkinson's? And when they ask me about that, they're talking about this medication called Ambruxol. And so this is actually a cough medication that's used in over 50 countries, except the US, essentially. So it's not FDA approved in the United States right now. But it works with an enzyme that's actually tied to a specific gene mutation in Parkinson's. So that's the idea. It is being studied now for the past couple years, seems pretty safe. Right now there is a phase 3, kind of last phase clinical trial going on with it. And they're looking at people that do and do not have this known genetic mutation. So they're trying to see, is this just a gene-specific therapy or could it help everybody? I am not going to spend a whole lot of time on this, but I've gotten asked by a couple folks about this study, this medication that's called FGF1. It stands for fibroblast growth factor. The idea is that you have little blood vessels in your brain that are causing damage to those dopamine cells, and that's why they're dying off. And so this medication is supposed to stimulate the brain to make new blood vessels to hopefully slow down Parkinson's. And so this was a study that was done in the Bahamas. They gave the medication through the nose, actually. That's what the nasal route means. I also don't know why it's the Bahamas. It sounds wonderful. Sign me up. They did not release how many people they tried it on, but as of the end of the year last year, it seemed like it was safe and well tolerated. So we will see where that goes. That one is still pretty early on, but I have had a couple people ask me about that. This is a very popular question that I get in my clinic. What about CBD, marijuana, all of that stuff in Parkinson's? And so it certainly has been studied. They actually just published a study in this journal called Parkinsonism and Related Disorders. They had a pretty good chunk of people, a little over 150 folks. They had some that were doing medical grade cannabis, marijuana, and they had a control group. And they actually watched them over a long period of time, from 2008 all the way to 2022. So they had a pretty long gap that they got to observe these people. What they found is that it wasn't really good or bad, I guess, so it didn't really seem to have any effect on motor symptoms. By that I mean tremor, slowness, stiffness, those type of things, or the overall disease progression of Parkinson's. It didn't hurt it either. So I guess there's that. And one of the primary things they were worried about is if people that have memory issues or psychiatric disease could have worsening of those symptoms doing cannabis or marijuana. And that did not seem to be the case. Just a quick slide. Stem cells are another kind of hot topic in Parkinson's. Really is only a symptomatic treatment at this time, but the idea is that if your brain cells are dying off that make your dopamine, let's just give you some new ones. So we're kind of still working on refining those techniques, and so stay tuned on that, but stem cells are just another thing that I do get asked about pretty often. And then this is a study that actually was taking place at UNMC here. Not with our group of neurologists, but with a separate group of neurologists. They were testing an anti-inflammation or inflammatory medication that they gave as a skin injection. And they had a group of 5 patients that they looked at for nearly 3 years. And looked like that their symptoms remained stable, which in Parkinson's, you expect them to gradually get worse. And so they were interpreting that as, well, people are staying stable, maybe that's a good thing. Currently, this study is active, but they've already kind of completed the part where they're giving the medicine to the group of patients that they have, and so they're just really going to be doing more studies on those folks, so they're not actually bringing new people in. All right, I'm going to talk just a little bit about the genetics and what we're doing with that in research. Dr. Sire talked about this already, so I'm not going to delve too much into genetics in Parkinson's, but what we do know is that age still remains our greatest known risk factor for Parkinson's. We know that people of the male gender are a little bit more likely to get it as well. And then Dr. Sire already talked about all these other risk factors that we know about, like pesticide and fungicide exposures, head injuries, medications. We know that apparently after today, we all need to be taking our smoke and coffee breaks, and that'll help us. But what we know about genetics in Parkinson's is rapidly expanding. Up until now, we really thought still that only about 10% of folks will have some type of genetic Parkinson's, so still not the majority. But if you do have one, it can certainly increase your risk. And we do know that people that have a family history, that's what that FHX on the slide means, have a 3 to 4 times risk of developing it. And so why do genetics in Parkinson's matter? Well, the truth is that we used to always think we treat it the same anyway, we use the same medication, so maybe it's not really high yield to look into. But we now know that looking into genetics helps to validate what our theories are about what's causing Parkinson's. It can help us to know how someone's disease might progress. So there's a couple different genetic types of Parkinson's that we now recognize behave a certain way, with how they progress, how they respond to medications, and a bunch of different things. It also helps us to design clinical trials to see if there are specific medications or treatments to help those subset of people. So the 2 I'm going to mention are these 2 highlighted here on this slide. They're acronyms. So the first one is leucine-rich repeat kinase 2. Sometimes that one's called LRRK2. That one helps us to regulate our alpha-synuclein protein in the brain and kind of helps us to clean up waste in the cells. And so there is currently a phase 3 trial looking at a medication for that, just has a small handful of patients. And then the other one is this one called glucocerebrosidase, or GBA. That one also helps to break down waste in the cells. But an example of that is that Embruxyl cough medication that I mentioned earlier. It works with GBA. There are a couple different studies right now, none in the US, because that medication's not FDA approved here, but they are looking at people that both have that genetic mutation and those who don't, as I mentioned earlier, to see if it's something that can help people. Okay, I know that this has been kind of a blur. We're moving quickly here. I just want to make sure I cover everything. I'm going to talk about biomarkers next, and so let me give you a definition of that before we start. Biomarkers are something measurable, something in an organism, that being us, human beings, whose presence indicates some type of phenomenon like a disease, infection, or exposure. So in our case, we're looking for something that we can measure from the body that indicates that someone has Parkinson's or may be likely to develop Parkinson's. So, how can we use these and why are they useful? We know that although we got to toot our own horn a little bit and say our clinical diagnosis is still pretty good, it's still only right 80 to 90% of the time. So that's how often we still correctly make a diagnosis of Parkinson's, by looking at somebody and doing their exam and talking about their symptoms. But we can use biomarkers to detect Parkinson's before it starts. That's what we call prodromal Parkinson's, so you don't have tremors or stiffness or things yet. We can help it to confirm or support a diagnosis. We can guide disease progression or prognosis. And then we can also help differentiate between things that look similar. So Dr. Sire talked about that Parkinsonism term before and what that means. So helps us to kind of tease out those Parkinsonism folks. And then we can also use these biomarkers to see who are the best candidates for some of these really tailored, specific studies or clinical trials. Okay, so there were a couple in the news this spring. The Omaha World Herald actually did one on a study going on at CHI, and then there was actually a big one through the Michael J. Fox Foundation. They announced about one in the spinal fluid that I'd like to talk to you guys about. And so there was an article in this journal that's called The Lancet back this spring. They actually had a bunch of patients, almost 1,200 folks, that they took from this database, and I'll mention this database at the end of the talk, called the PPMI. And they had a range of people. So some people that already had symptoms of Parkinson's, some people that had not developed Parkinson's symptoms yet, people that had a known gene mutation, and then what we call controls, so just any all-comers off the street. And all of these folks consented to having their spinal fluid looked at. And what they wanted to do was try to detect alpha-synuclein in the spinal fluid, or what we call the CSF. And here's that alpha-synuclein thing again, so that protein that's thought to build up in Parkinson's brains. And so actually, for its use in ruling in Parkinson's, it looked like 87.7% of people did have a positive test who also reported Parkinson's symptoms. And then 96.3% of those healthy controls, people without Parkinson's, had a negative test. And so those are kind of the two features of tests that are really useful to us. How good is it at confirming what we're looking for, and how good is it at ruling out what we're not looking for? And so actually, those Parkinson's patients that also reported a change in their sense of smell, which is well established to be a symptom that can predate other symptoms of Parkinson's by many, many years, the test was even better. It picked up 98.6% of cases then. This one that was through CHI Creighton with Dr. Melinda Burnett, she is their movement disorders neurologist there, is a blood test, kind of looking for something similar. So they're looking for a messenger in the blood that kind of helps to pass on that toxic alpha-synuclein protein. And so that's the idea behind that study. I don't really have any super up-to-date information on that, so if anybody out there knows anything about this study, come find me and let me know. But last I had known earlier this year, they did have 10 patients enrolled and they were looking for some more. I'm gonna do a couple notes on some databases, and then if I do have a couple minutes left, I'm gonna talk about some of the other studies at UNMC, just in brief. So by databases, I mean collections of people with Parkinson's or even without that consent to be part of just a list of people and may give information or go through tests and have that just be used for studies. Just use that as a group of people to then use for future studies. And so this one I had mentioned earlier with that spinal fluid test is one that's called the PPMI. That is the Parkinson's Progression Markers Initiative. That's through the Michael J. Fox Foundation. They take all comers. So we talked about that article earlier where they had healthy controls. They had pre-Parkinson's people without a diagnosis of Parkinson's. They had people with Parkinson's or people that just had a gene type of it. So you don't necessarily have to have Parkinson's to be part of it. You fill out information online. There are some locally enrolling sites down in Kansas City and then Chicago and Denver as well. But the really beautiful thing about this database is, well, there's several beautiful things. They have a lot of people in it. So they have thousands and thousands of people, which in terms of research and how good it is, the more the merrier, the more the better. We need lots of people. And then the other really nice thing is that for those people conducting research on Parkinson's patients, they're very open about letting other people use their data for whatever they want to learn. Dr. Sire already talked about PD generation. That is the study that you literally just Google the name, PD generation, if you're interested. This is also one through the Michael J. Fox Foundation. This one, they have you check a box that says whether or not you've been diagnosed with Parkinson's. So it's not terribly stringent. You just, honor system, do you have it or no? And then they do have in-person or remote enrolling sites. So we're not an in-person site, we're remote only right now. But I have had several patients who have done this. And as Dr. Sire mentioned earlier, they had found that almost 13% of people did have some gene that popped up on it. So it does have some yield. But if you happen to sign up for this, it involves a couple steps. You have a screening visit that you come in for. They do have an appointment then where you give a sample. So they will do something like they'll have you take a swab and put it in your cheek. That's how they collect DNA data. And then they actually have you meet with a genetic counselor after that, which I think is really great because that is the place where you learn what do these results mean for me, what do they mean for my family, what kind of other testing or things do I need to do based on these results. So that's a really, really important part of the study. And I didn't even mention it on the slide, but of course the other beautiful thing is that it's free. And so genetic testing in medicine is very rarely ever free. It usually costs an arm and a leg. And so to have a free option is fantastic. So on this slide, these are the options and contact information for how you can get involved in these studies if you're interested. So one of the best places to go to, but also not a super intuitive website, is one that's called clinicaltrials.gov. And so on that website, you do need to search by disease. So if you type in Parkinson's disease, it'll bring up all of the clinical trials that are going on, past and present. So not necessarily ones that are enrolling people or recruiting people to come in. And so you do need to use their search engine on there to check the boxes for who is actively looking for people to participate. And then you can search by state and those kind of things. At UNMC, we also do have what's called a research advocate office. And so they are available by phone or email. So I have included that email and phone number on there for you. And if you contact them, they'll get some information about you. And if you do kind of qualify for any studies they have going on, they'll match you up with that. We also do have a clinical trial database too. I know that's kind of a lengthy email or internet address I put on there. And so if you go under this research advocate or just Google UNMC clinical trial database, that's probably a surefire way to get there. Okay, I do just want to mention in my last couple minutes here, I have a couple good websites for you guys to reference at the very end of the slide. So this is where I got a lot of my information from today. Loads and loads of information. These are great websites to check out. The current studies going on at UNMC are that one that I had mentioned before with the IV injection medicine, but then we also have a couple studies going on for folks that have deep brain stimulation already done. So I didn't mention that here in this talk or these slides, but for those folks that have had deep brain stimulation done, those are the currently recruiting studies at UNMC. So of course, just ask your neurologist or your surgeon about them if you're not currently enrolled and you're interested. All right, I think that is it for me. So we're gonna wake you guys up now. You've had your lunch, you've had your enormous cookies, so it's time to get up and have your movement break with the Heartland folks. They're gonna come up next.
Okay, we are going to get moving. We have some songs that we are going to get some good Parkinson-specific movement going with. So if everybody that can, please stand up and kind of step away from your table. You're going to need room to move. We are going to grab a chair. Would you be able to grab one chair? We will show it in sitting. We will demo also in sitting. But again, if you can stand, please do. The idea of this is to have fun, right? So lots of smiles. Feel free to, I always say in all of my classes, feel free to sing if you want. And we're going to just have a little fun getting moving. So I think they're going to cue the music for us. The very first song starts right away with your arms like this. So get prepared because it starts right when the music starts. So, okay, is everybody ready? Okay. Okay, that is not the right song. Feel free to dance. That is not one of the songs. It's not a bad song, but that is not one of the songs. I don't know if Sally's around. We're looking for the song Boogie Shoes. Is that on the playlist back there anywhere? I don't know who's doing the music. That would have been an interesting choice for a song. Oh, here we are. Some of you may have done this with Georgie a couple of years ago, but we couldn't do this without boxing. So we are going to do a little Eye of the Tiger. So get ready to box here, okay?